The basic anatomy of hearing is pretty much the same for all organisms. There are 4 pieces to the structure of the ear: the outer and middle ears that I will cover in this video, the inner ear, and the auditory pathway that starts with the 8th cranial nerve that I will cover in other videos. The outer part of the outer ear is visible by what is called the pinna or auricle, what we might think of as the ear lobe, I guess. All the structure in the outer ear is provided by cartilage. Its function is to collect up sound that then gets processed by the middle ear and the cochlea in the inner ear. There are a variety of landmarks around the pinna: the helix, the tragus, the lobule, and the antihelix. And then the entry area toward the middle ear is referred to as the concha. From the concha, we enter the external auditory meatus, a tube roughly 2.5 centimeters deep that terminates at the tympanic membrane. Roughly the inner 2/3 of the ear canal, this external auditory meatus, is housed inside the bone, the temporal bone, the mastoid process where the ear is located. The more lateral outer 1/3 of the ear canal gets structure from cartilage. It's lined with ciliated epithelium, and it's also where we find the cerumen, our fancy name for earwax. The ear canal is a sound resonating cavity that affects the frequencies that are entering the ear. You'll learn more about that probably in your audiology classes, and I will talk a little bit about it in speech science for those of you continuing in the CSD major. The tympanic membrane, also known as the eardrum, separates the middle ear from the outer ear. It has 3 different tissue layers. The external layer is continuous with the epithelium that comes from the external auditory meatus, so that continues all the way out to the outside of the body, basically. The middle layer is a fibrous connective tissue, and the inner layer is the lining of the middle ear. When looking at the tympanic membrane, like with an otoscope that an audiologist would use, there are some visible landmarks: the umbo in the middle and the manubrium, which are both projections of the bone that's behind the tympanic membrane, and then also a fleshy area known as the cone of light, basically because it lights up very obviously when you do shine a light from an otoscope in there. The middle ear is a transmission chain consisting of the 3 smallest bones in the body. These bones are called ossicles, and they are in order from external to more internal: the malleus, the incus, and the stapes. And basically what happens is, as the tympanic membrane vibrates, that vibration moves these 3 bones, which then vibrates another membrane over the oval window and transmits that sound energy to the inner ear. The first ossicle is called the malleus, I guess because it looks a little bit like a mallet or a hammer. It's the largest of these 3 small bones. It's got a point of attachment with the tympanic membrane at the process known as the manubrium. And it also has a point of attachment with the incus at a location called the malleoincutal joint on the head of the malleus. The malleus is held in place by a couple of ligaments: the superior ligament of the malleus, which connects to the head, and the anterior malleolar ligament, which connects to the anterior process of the malleus. The incus gets its name, I guess, because it's shaped like an anvil. Don't really know what an anvil looks like, but there you go. This provides an intermediate link in this ossicular chain. The incus and the malleus articulate on the incus at the malleolar facet. The incus and the stapes, the next bone, articulate at the lenticular process, which is at the end of the long process. The posterior ligament of the incus suspends the incus in the middle ear by attachment to the short process on the incus. The superior ligament of the incus attaches near the articular surface where the incus connects with the malleus. The stapes, or stirrup bone, is the last bone in the ossicular chain. The articulation of the incus and the stapes is at the head, a little ball that fits into a socket that's on the lenticular process of the incus. There are two bony arches, the anterior and posterior crus, which connect to the foot plate, which is the connection of the stapes to the oval window of the inner ear, and movement of the foot plate is going to displace the membrane over the oval window and create vibrations in the inner ear that get processed by the cochlea. There are a couple of important tympanic muscles in the middle ear that affect how the ossicles operate. Like these very small bones, these are also very small muscles. The stapedius muscle inserts into the stapes, comes from the posterior wall of the middle ear. It's innervated by a branch of the facial nerve. And the tensor tympani, which inserts into the manubrium of the malleus, comes from the eustachian tube, which I'll mention in a second, connects the middle ear to the vocal tract and is used to equalize pressure for the air in the middle ear. It's innervated by the fifth cranial nerve. Both of these muscles can stiffen in order to reduce the amount of movement of these bones when dealing with very loud sounds. This tends to be most effective for low frequency rather than high frequency sounds. This contraction is done by a thing called the auditory reflex in our neurological reflex systems, and the idea is to protect the inner ear from being damaged by very loud noises, because overall the effect of the middle ear and the ossicular chain is to make sounds louder to amplify the transmission of energy from the outer ear to the inner ear. If you look at the cavity that the ossicles are in, there are a few important landmarks on that cavity. You find them on the medial wall, meaning the side of that cavity that's toward the inside of the head. There's the oval window that leads to the inner ear. There's also the round window, another connection to the inner ear. There is a projection where you see where the cochlea on the other side of the middle ear in the inner ear is located. There's also a prominence for one of the semicircular canals from the inner ear that you can see on the bony wall. There's a connection to the eustachian tube, also known as the auditory tube, which helps maintain the air in the middle ear. That's the thing that you feel pressure on when you say drive down off the mountain out of Boone down to the low country. Difference in air pressure up here versus down there needs to get transmitted to the middle ear, and it does so through this eustachian tube. But it's not just a continuously open tube. It gets opened because there's kind of fleshy bits around it. Gets opened when you do things like swallow, which pulls on it a little bit, and that helps equalize the pressure. The last landmark on the middle ear is the stapedial pyramid, where the stapedius muscle emerges and connects that muscle up as well to its innervation in the facial nerve.